Actually, Nancy Latimer helped me launch my career here at Wellchild. I started here about 27 years ago, and she was on the advisory committee for the single-parent family study that I did. And at that time, we were interested in the feminization of poverty. You all remember the feminine. We're still concerned about that. But now our big concern is about poverty in early childhood. It's a childhood disease. And that's where Jane Kretzmann sort of is in that same mold of being that passionate advocate for vulnerable babies. And she's fashioned this team of people that are trying to translate the brain research into effective practice, into effective policy. And that's why she's being honored today. I thought that the funders committee, or maybe even ART, reconsidered the award today, because as I was driving here, Dan Olson gave it to me. So I wanted to thank ART for that. But actually for Art and me, this serve and return, it has a whole different meaning. Whoever can return the other person's serve usually wins the match, or it has fewer unforced errors. And kind of an issue for me lately. But seriously, honoring Art and Jane, it's both together, not one or the other. I think that's an important message for the early childhood field. It's a clear message of what it will take for all kids to succeed, or at least for them all to have an equal shot at succeeding, because they come at it from different perspectives, but we need them both for kids to be successful. So what do we know for sure about what it's going to take to close these opportunity gaps? Megan started off also with Neurons Neighborhood. So Jack Jungkook, he introduced us to the field of brain science, the wiring that Megan talked about. We've known about that for 10 years at least, 20 years. Art and Rob's work, it's world-renowned, that investing in high-quality early education for the poorest kids gives us the biggest bang for the buck. They call them now the high-return kids. That's the importance of the economics for that work. It's a better economic investment than what we know for department stores or stadiums or airlines. That's comparing what we can get up from kids. In Minnesota, actually is known around the country for its business involvement in early care and education, really more than any other state. They became concerned about this because of its implications for the workforce in Minnesota. And they rallied around the brain research and the economic arguments, and they gave us what I call it the pumpkin report. Remember the pumpkin report? It brought together what the business community said was how to invest in children to get us off to the right start so we can have a strong workforce in Minnesota. And this is what eventually became the groundwork for MELF, which then started testing the scholarship approach. So we've known about that for many years. There's additional evidence. This is not getting a lot of attention, but for 5 years, the Future of Children report from 2005, it compiled evidence that quality early education for poor children was necessary, but it wasn't sufficient to close the opportunity gaps, or to close the school readiness gaps between white kids and African American kids, or white kids and Latino kids. This showed that quality preschool can close that achievement gap maybe 20%, that white-black school readiness gap, and maybe about 36% of it for the Latino, Hispanic, white gap. But if you want to close more gaps, you have to have more resources and more types of interventions. One type of intervention alone, especially one only early education as an intervention, is not going to close that school readiness gap. So it's not strictly additive. You can't just sort of add something in, because family support closes 50% of the gap. Health closes another about 1/4% of the gap. It's not like you add up 50, 10, you got 100. But what it shows is that it takes more than one thing to close this intervention gap. That you need some sort of coordinated connection of services. And that became signified in this. Everyone who hasn't seen the 4 ovals, I don't know, you haven't been in a cave, probably, because this has been what has been the work of the past 5-6 years by Minnesota Build and the Minnesota Early Childhood comprehensive systems initiative in the health department to signify that we need more than one thing. We need this intervention that are connected, coordinated, in order to close the achievement gap and to make sure that all kids have a good start in life. And the last key reason to close these gaps, I call it the demographic imperative. That if you look at Minnesota's population in the age groups, the Minnesota's youngest children, they're the most diverse part of the population. Really a quarter of that group are kids of color. So they're the most diverse age group. And then the projected growth in Minnesota is all due to those kids. The increase in the number of children of color is what is making up the future growth of Minnesota. If we're interested in a productive workforce to take care of all of us and to make this state thrive, we have to be concerned about closing the opportunity gaps for that population, which is the fastest growing part of Minnesota. So I ask, how many little brains in Minnesota have already suffered these lost opportunities, even though we've known the potential damage and the costs of that not providing the resources those kids need? The damage at the biological level that teaches us about. So is it 15,000 a year? Has it been 100,000 kids over the past 5 years? No. Just what are we waiting for? If the science and the advocates aren't convincing enough, here I've got some evidence of need that may be more convincing. And this is what's in that babies report that you can pick up if you have a minute. Looks like poverty again is headed in the wrong, and this is probably worse given the recession in the past 2 years. This is updated from 2008, the proportion of young kids, 3 and younger children in poverty. So 14.5%, it was 12% in the year 2000. So we're talking about 41,000 children ages 3 and younger living in households with incomes of $22,000 a year or less. If you raise that to 185%, say 40,000 a year, you get up to 83,000 kids that are living in these households where they're under some sort of economic distress. So the consequences of the poverty we know is lack of basic need being met, lack of basic resources. But it's more than that. It's the stress of having to put up with that. It's the uncertainty of not knowing when the resources will be there and not be there, which adds to that stress. And then it's what I call it the iron triangle. It's these barriers to achieve begin earlier that Megan talked about. Because if you start poor, you're a lot more likely then to be uneducated and sick. They sort of go together. So if you start unhealthy, you're more likely to be uneducated and poor. And if you start uneducated, you're likely to be sick and poor. They all go together. But here we're talking about a large number of Minnesota kids starting at an economic disadvantage, where it's going to be very likely and difficult to get out of that iron triangle of lack of education and poor health that stems from that economic deprivation to begin with. And this is disproportionate by race in the state. If you're an American Indian child, 60% of those kids are growing up in poverty. 42% of African American kids. A third of Latino kids. Megan talked about the importance of Tier 1 resources, access to basic health services. This is a basic health service where the achievement gap, the readiness gap, the opportunity gaps begins right from the get-go with regard to prenatal care. That this is the proportion that have adequate prenatal care. So you can see for American Indian kids, right from the start, they're at a disadvantage where less than half of those mothers are receiving adequate prenatal care. About a third of Latinos don't, and so on. So this limited access to basic health services is part of this reason that kids start off at a disadvantage. It continues with access to basic health services for Wellchild visits. We do a pretty good job of getting children get their first well baby visit. But then by age 2 and 3, you can see it begins to drop off, especially for American Indian kids, where it's about a third aren't getting their well baby visits. Only about 25% or more of other groups are not getting their well child visits after their first one. we're doing a pretty good job. And then early learning opportunities. So we do not have very much coverage for kids under age 2 and younger, or age 2 and younger, with regard to early Head Start. It's only about 10% of those who might be eligible are receiving those early Head Start services because we just don't have a lot of early Head Start in Minnesota. It was expanded recently, but we still don't have it. Most of the kids that are age 2 and younger are at home with their mother, primarily, or their grandmother. 78%. Often that's by choice. That's where they want to take care of the younger children. We know that from our family, friend, and neighbor studies. But it's also due to lack of access to other choices. So it's not necessarily what they want to have, but that's where most kids are being taken care of. That's important to remember, and I'll go into that in a minute. The Head Start programs, in 2000, they were serving about half of the eligible kids. But because of the growth of the kids in poverty, right now they're serving only about half of the eligible kids. And then if you look at children from the Child Care Resource and Referrals information and from other studies, if you look at low-income 3-year-olds, it looks like at least 13,000 3-year-olds are in not any form of early learning program that might lead to their school readiness. And then if you look at access to other forms of resources to pay for child care or preschool, only about 1 in 7 of those eligible for our Child Care Assistance Program are accessing that program. So we can see we have kind of a dismal record when it comes to access to early learning opportunities. But this is just talking about the access to the program. It's not talking about anything about quality. I think we can boil down, Megan talked about quality too. I think we can boil it down to 3 basic things. And this is whether they're at home with the mother, grandmother, in a program. This is not necessarily based upon what a program has to do. I like to take, what does a child need? We should be focusing on child development is our goal here. Not professional development, child development. And what do children need? What is quality from a child perspective? They need a caring and responsive caregiver, that consistent, caring caregiver. They need a language-rich environment. It doesn't have to be an English-rich environment. It has to be a language-rich environment. And then they have to have opportunities to safely explore. So the safety is sort of given there. But one of the key signs of being ready for school is that you're curious. You just want to be sucking things up. Tell me more. Look at you. Grab. Curiosity is one of the key signs of school readiness. And having those opportunities to follow your curiosity is a key sign that someplace has quality. So these are the sort of, I think, 3 key interrelated parts of quality that don't require a program. We know our parent-aware quality rating system. Some of the indicators of that have operationalized these into a professional staff that's had training in these sorts of things, or having an evidence-based curriculum, using research-based materials. But what it boils down to is being able to have this, as Megan says, this serve and return relationship in a way that allows that child to fully develop. So what do these opportunity gaps mean? Well, first, it's sort of depressing here to talk about, but keep in mind that most kids are doing well in Minnesota, but there is a sizable portion that are not. And it's those vulnerable groups that are the populations that are growing. So to me that says we have to do a better job of targeting. We have to extend the resource to the groups that need the most. And then given that growing diversity, we can't be doing, we hear a lot about doing more with less. I like to say we need to do different with less. That different with less means we have to tailor more to the needs of the particular populations that are vulnerable, so that we can, so that the resources and the opportunities fit their context. We have to be flexible in terms of what we allow, how we allow the resources to be used, so that they can be adapted to local and cultural communities. So it's not just more of the same. Even if we had more resources, it should be different, not more. And then to close those gaps, we can't just focus on one thing. We can't just focus on early learning. It has to be comprehensive and coordinated. Narrow focus will only close part of that achievement gap. So what does that mean? It means that for some kids, by age 3, they've already suffered some of the consequences of lack of early brain development. So if we wait to screen them to find the issues, it's already too late. It's not too late in terms of their lives, but it's too late in terms of the amount of resources it takes to bring them up to speed. It's cheaper and better to start as early as possible in order to prevent the problems before they happen. We have to prevent these gaps as opposed to close these gaps. We have to prevent the achievement gap as opposed to trying to spend all these resources to close it. Well, thanks to many of you, and Art and Jane and all the Early Childhood Funding Network and the Ready for a K advocates and the advocates that join them in the Minnesota Futures Advocates. There's been all these building blocks that have been developed and promoted around early childhood for the past 10 years. And maybe there's not a consensus, but I would say it's fairly widespread about really where we're headed and what we need to do. And I call it the 4 Ps: public, private, piecemeal, progress. We haven't really, and then I guess the 50 would be pilots, because we are the land of 10,000 pilots. And these all things, these developments and pilots, the awareness expectations, they fall into 4 categories. Awareness in programs around the whole child, the developmental process, the return on investment, and then accountability for quality and results. This is what the whole child, that's what Build and MEX have been up to for several years, connecting those 4 ovals, making them stronger. All the work in children's mental health, the MIFS and their Thrive initiative, the Foundations for Success in Ramsey County, the broader use of ASQSE as a way to look at children's mental health. We have a pilot on well babies. At a well baby visit, the mothers being screened for depression with the American Pediatric Association of Minnesota chapter, a small pilot. The focus on dental health as a key thing, and through Head Start and through the MIFS in West Central. The idea that parenting needs to be improved with the Twin Cities United Way Parenting Initiative, all our home visiting initiatives through the Metro Alliance and the Statewide Alliance and the Department of Health and their different models and MVNA. A big push to understand that's starting prenatally to address those issues early. The protective factors for strengthening families within the child welfare, idea about how we need to focus on those things around the whole child. And then it's not just whole child, but it's whole child, whole family, whole community. The idea that community building is an important part of this. And communities may lack the capacity to organize the resources that kids need to address the most at risk. This is what the MIFS have been doing for the last 10 years. Linda talked about the kinds of information we're pulling together. I mean, they're now in 86 different local coalitions in over 200 communities. They've organized different activities, events, and strategies based upon local needs and priorities. And what they've done is develop this more holistic picture of what the community is all about, of how the child fits into that picture of the community. And they've established this base of informed and involved community members, really a broad range across the range of possibilities and sectors. So it's business, it's police, it's the welfare, child welfare, it's AFDC or TANF, public health, early care and education. It's getting providers and kindergarten teachers to talk to each other. They've created a solid base of building a capacity of local communities to address the need. They still need more resources to blossom the capacity and to transfer the capacity to all the families and kids. But they've put what they've done for the past 10 years to work through collaboration to raise that capacity within communities. School readiness, you've heard me say this a million times. It's a developmental process that begins prenatally. It's not an event that happens after the kindergarten program. A lot of what we've done is address this within the framework of a developmental process. The focus on targeted home visiting starting prenatally is part of that awareness and that recognition that this is a developmental process that starts early. We have actually one of the success stories in the state is newborn screening, where we have nearly over 90% of kids with hearing and hearing problems. They're detected early and they're provided that resource that they need. So that's actually a success in the past several years. And then being more worth it also takes that transition to kindergarten to be effective and easier for all children. That's a lot of that's been focused on in Linda's initiative foundation, the Northland Foundation, with Lynn, southern part of Minnesota, other parts of the Minnesota. They focused on that transition as part of that developmental process for children. We wouldn't be here if it wasn't for Art. I mean, he has inspired so much of this investment with high rate return rate. That has been, some call it a shtick, but he's promoted and around the world about the attention that's gotten. And it was the inspiration. I mean, it's directly through the Melt Scholarship that grew out of Art's and Rob's work, where we're providing access to low-income families, empowering them to choose quality programs. They must be quality, rated through the quality rating system to be used the scholarship, but access to quality. The state, for I think it was 1 or 2 years, had that scholarship light. They had pre-K allowances that families could do the same thing, where they could get a supplement, purchase that service. Invest Early, the initiative up in Grand Rapids, which combines the Head Start money with the school readiness dollars, combined with the private money from the Blandon Foundation. That's what that Art inspired that as well, an idea that we need to invest early in order to get the high rate of return for a kid. And then Art and I have this debate, and it's part of the conversation among funders. And what I heard in the asset review, I think that communities need scholarships too, not just families. That the things that the MIFs are doing could be expanded with additional resources. What really Invest Early is doing by this blending and extending of Head Start services and other services for the younger families to more poor kids is through that scholarship from the Blandon Foundation that supplemented the public dollars that were there so we could serve more children. So this is a profile of how the 344 scholarships in Frogtown and North End, where they're being used. So if you look at this profile, it's 50%, 59% are at centers, sort of evenly divided between for-profit and nonprofit community-based. 30% Head Start, and then much lower licensed family child care homes and school-based programs. To me, this is a distinctly urban profile. The market in rural Minnesota would look totally different. Because in rural Minnesota, they have more licensed family child care. And we hear lots of complaints about the school system, but when you go talk to people in rural Minnesota, the schools may be the only resource for those kids, and that's the place they want to work with and do work with. So this profile would look a lot different, would have to look a lot different in greater Minnesota, because the market is so much different with regard to what's available there in rural Minnesota. This is why I say we need both family scholarships and community scholarships, because we have to have something that works for all of Minnesota. And I think that's what Invest Early is sort of paving the way for that. So the last area is accountable for quality and outcomes. And we've had a lot of work in this area. The whole Parent Aware pilot, our quality rating system with the R&Rs and DHS and through MELF. The pilots around improving quality of care for children and family-friendly neighbor care. The promotion and development of early learning standards, the professional development system and what it takes to be a competent provider, the annual assessments of kindergartners as they enter school. We have sort of that in place now. That might be need to expand it. We had a lot more accountability that was passed in the last legislative session that the Early Childhood Funders Group recommended, and then it sort of got the Early Childhood Advisory Council was handed off to them to sort of figure out what it was and how to do that. So exploring that Office of Early Learning, having a school readiness report card so we can see how we're doing on an annual basis, They want to improve the amount and number of kids who are being screened at early age and then assessed when they enter kindergarten. A big improvement that a lot of advocates were fighting for was to help facilitate the comprehensiveness we need, is to add a Department of Health representative to the council. Before it was Education and Human Services, and now it's got all three. And then the council is also responsible for designing a data system that integrates both across these different programs, so we can have a fuller picture of how kids are doing. Right now, we're spending an estimated, the state is spending, oh geez, 400 million from state. It's mostly federal dollars, more federal than state dollars. The foundations, when last counted, about $24 million. The biggest investment in early childhood right now is private dollars, and that means family dollars, about $1 billion a year. How much more do we need to bring it to scale? Well, if you take those 13,000 3-year-olds that aren't currently served and give them 2 years of service, after 2 years, it would be roughly, I added up about 216 million more. If you want to make sure that all kids have access to dental care and health care, it's another 44 million. If you want to have targeted home visiting that are truly targeted and reach all the high-risk populations, that would be another 25 million a year. If you want to increase screening and assessment so it's more universal, that would be 16 million. And if you want to have this FFN support, since a lot of kids are in FFN here, it's more than a pilot but brought to scale, that would be about 2 million a year. So we're talking about, we need another 300 million to bring all of this to fruition. What we've been trying to do for the last several years is preserve what we have now. We're obviously not adding in anything new. But based upon the evidence and need and what works, if we want child development for all kids, it's going to take at least 300 million more. It sounds like a lot of money, but it sure does cost a lot more to not invest. It's billions of dollars it costs to not invest compared to $300 million to invest. Well, we have several different policy plans that are now trying to produce a uniform agenda for the next governor. The Early Childhood Advisory Council, the Funders Group, the Minnesota Futures Group, MELF. What this says is that what we're looking at is governance which sets policies for financing and accountability. We have the Office of Early Learning is a governance proposal that was proposed by the funders and it's now handed off to ECAC. Financing, we've got some proposals from MELF around tax credits. And we have ideas about layering some other additional money onto what we have so we can extend what's already there. And then accountability was the key proposals out of the Early Childhood Funders Group. That the indicators, the data system, the report card, the screening, it's all around accountability. And virtually all the plans rely on a quality rating system where you have expecting quality to get those results. But what policies do we need from this governance structure if we're going to have child development for all kids? Well, we have to improve access to close the gaps, we have to have quality, and we have to have outcomes without the disparities. In effect, what we're saying here is that the governance oversees a system of financing and accountability, not just of programs, but it's a system of financing and accountability for child development, whether it's programs and families. It has to be grounded in demographic reality. It has to be targeted, tailored. It has to be different, not more of the same. It has to look at both opportunity models, like the scholarship arts model is an opportunity model, and service models, like the Invest Early model, which promotes these services that can be combined to serve more kids. It has to be flexible to adjust for local needs. And we know that through the brain research that we have to do it the earlier, the better. And then we have to acknowledge that families and programs and community agencies and FFN and licensed providers, they are non-interchangeable. We have to bring families and communities back into the picture. We have to empower families as much as we develop professionals. We have to develop the capacity of communities as much as we develop professions. That is the key to ensuring that all kids have an equal chance for full child development. So, Jack Jungkook, again, he says he wants us to guide early childhood policy by a biodevelopment framework. What does that mean? It means we have to close the gap between what science is telling us and what we do. It means we have to be more pragmatic so that we can have a more humane present and a more promising future for all children. So, I was thinking that as Minnesotans, if you grew up here or you moved here, that probably one of the first things you'll learn is you have to take your turn. You raise your hand when you want to be called on. We have to be taught how to butt into line in a construction zone because we think we have to line up. We're a queuing group of people. We hate people who budge in line, right? We espouse the virtue of being patient. Oh, we'll get there eventually. We think good things come to those who wait. It's crazy. Good things do not come to those who wait. Good things come to those who have solid evidence through economics and brain research, who have strong organizations and organizing, and have leadership. Leadership. That's what we need now. So that, and that's where you all come in. Early childhood does not have the priority it needs. It's an afterthought. If we're going to have early childhood have the priority that we need so that all kids have an equal chance to reach their full potential, you have to step up. You have to help be the leader so we can have a more humane present now. We can't wait till 2020. We have to do it now. And then we can have a brighter future for them and for all of us. So, what are we waiting for?